Hi, I'm Dr. Molly Platt of Revitalize Physical Therapy, pelvic floor specialist and women's health therapist. I'm here to show you a behind-the-scenes look at our running analysis. Come with me. So what is a running analysis? Well, as physical therapists, we're able to assess running form with our patients on the treadmill to improve running efficiency and prevent injury by pointing out areas of weakness or instability. We can help women who deal with a variety of symptoms during running as well, whether it's pelvic organ prolapse symptoms like vaginal heaviness or symptoms of incontinence like urinary leakage. What does our running analysis include? Well, we're going to spend a great amount of time with you learning about your running history and what issues you might be dealing with. We're going to ask you if you've been experiencing any pain, any leakage, and if there's any sort of correlation with what part of your cycle you're on during these symptoms. We perform a wide range of assessments starting at your ankles, your knees, your hips, and your pelvis to determine where there might be asymmetries in your running. Strength and coordination testing allow us to focus on various regions during the video analysis. We'll test the ability of your muscles to contract quickly and take on load during running, which can be close to 3 times your body weight. We'll assess your stride length and your running cadence and compare this with the slow motion footage to determine areas where you might be inefficient in your running. We'll slow down the video using a software, and we can assess the angles at your joints when you're landing and when you're propelling forwards. How do we analyze? First, we'll start by placing bright stickers on the bony structures to help mark off different parts of your pelvis, your spine, and your feet. We'll perform slow motion video recording and input the videos to a software to analyze joint angles, foot placement, hip drop, arm swing, and other key factors in your running form. The therapist will then be able to assess some of the findings in real time while we're watching you run. The remaining part of your analysis is done outside of the session, where the therapist is going to be breaking down the information from the running. She'll summarize the findings with you and write up a report that you'll get via email. What does the follow-up look like? We'll provide you specific exercises based on what we find in your analysis. We'll send you home with them to continue working on until you can come in again and have your running analyzed a second time. For most patients, we'll do a pre and a post test, so they've had some time to implement some of the recommendations into their routines and into their running.